The Department of Health Services is responsible for promotion, regulation and provision of healthcare services to the people of Kiambu County and beyond. The department is committed to ensuring that the services are of high quality and are accessible to every resident.
According to Article 43, every Kenyan citizen has rights to health and good standard in the highest possible standards. Kiambu County also treats many of its patients from outside our county. Approximately 30% of patients treated in the county are from the neighboring counties.
The county health system is structured along 5 levels of care that are guided by the Kenya Essential Package for Health (KEF). These levels are Level 1, Community Health Services, Level 2, Dispensaries, Level 3, Health Centers, Level 4, Primary Hospitals, and Level 5, Secondary Hospitals, otherwise known as County Referral Hospitals. The county government-owned facilities include 3 Level 5 hospitals, 11 Level 4 hospitals, 24 health centers, and 70 dispensaries.
Kiambu County, we have a number of facilities which are totals to about 110, of which 3 are Level 5 hospitals. That is Gatondo Hospital, Vika Hospital, and Kiambu Hospital. And we have 10 Level 4 hospitals spread out within the 12 sub-counties.
The department discharges its mandate as provided for in the Kiambu County Health Services Act 2019 through a County Health Management Team or CHMT. Before Governor James Nyoro assumed the leadership of Kiambu County, a number of projects had stalled going back to 2015. In the health sector, these included additional of medical blocks at Tigoni, Wangige, Lari, Thogoto, and Lusigeti health facilities. Upon assumption of office, Governor James Nyoro embarked on paying the bills. Construction and completion of the facilities was fast-tracked as COVID-19 struck the county. A few months after the pandemic was first reported in the country, the new block at Tigoni was launched. The 300-bed capacity hospital was converted to be the designated Kiambu COVID-19 center. At this time, an advisory committee had been formed to help contain the pandemic and mitigate its effects on lives and livelihoods in Kiambu.
When I came in, we found some stalled projects. 4 of the stalled projects were in Kiambu West. The 4 hospitals that had stalled. And we started working on them, and we wanted to open officially those facilities. And when the COVID came, we saw an opportunity of closing Tigoni and making it a COVID center.
The committee saw the need of additional isolation beds. Together, they helped put up a fully equipped 104-bed capacity block next to the Tigoni block. Also, another fully funded project is being put up by the county government at Ruiru Hospital. The 150-bed capacity will be used for isolation purposes and later be converted to medical wards. As the numbers of positive cases of coronavirus patients surged, the department had embarked on a series of activities. Using the pillar of preventive and promotive healthcare, a county response strategy that links the 12 sub-counties to the County Health Management Team and the county executive was established. Its key mandate was rapid response to suspected cases of COVID-19.
Preventive and promotive health care was a pillar which was being established all along. There was fumigation of markets across the county. There was barriers and inspection of eateries. There was hand washing points in their thousands set up across the county. There was use of masks, and more so through the Department of Education and Technical Training. There was provision of free masks to wananchi, so that all the mitigation factors, hand washing, use of masks, social distancing, they were all unveiled in different parts of the county. And that is actually the community wall that prevented COVID from sprouting in its second wave in Kiambu.
The county also invested in more isolation beds within its 3 Level 5 hospitals in Thika, Kiambu and Gatundu, bringing the total of isolation beds to over 900. Oxygen being a key treatment for COVID-19, The county installed bulk oxygen in its level 5 hospitals and at the Kiambu COVID-19 center in Tigoni. The oxygen supplied is connected directly to a patient's bed.
One of the things that we did, and I want to thank BOC, was to install bulk oxygen in all our facilities. So all our level 5 hospitals, we have installed bulk oxygen, and we have now oxygen piped to every bed.
Before the advent of coronavirus, Kiambu County had a capacity of 5 intensive care units or ICU. However, through the leadership of Governor Nyoro, the county government has so far installed more than 50 ICU beds within its 3 level 5 hospitals and Kiambu COVID Center in Tigoni. With such infrastructure, the county became a center of medical tourism where the Cabinet Secretary for Devolution, Eugene Wamalwa, and the former Council of Governors Chair Wycliffe Oparanya visited the county in his capacity then.
Mimi nina furaha kuwa hapa siku ya leo na nimeandamana na waziri wa ukatusi kujionea yale maendeleo ambayo yuko hapa Kiambu. Nataka nimshukuru rafiki yangu Gavana Nyoro kwa hii maendeleo mazuri ambayo analetea watu wa Kiambu haswa katika sekta ya afya.
We are very happy to be in Kiambu County today and to see the progress made in ensuring that the health services are improved in this county and in this country. Kiambu County is one of the shining examples of successful implementation and also prudent use of the funding they have received. And today, after launching this program, Phase 1 and Phase 2, we have been able to see with our own eyes, both in Wangige and here in Tigoni, what Kiambu County has been able to achieve. Na tunasema hongera, Governor Nyoro.
The Public Health Directorate went on board to fumigate busy public spaces, particularly in schools, markets, and bus termini. They also sensitized members of the public on the set guidelines and distributed masks to schools and in markets. The county has also trained more than 2,500 community health volunteers on matters COVID-19. The volunteers then go door to door within the community, educating members of the public on matters COVID-19. The CHVs have also played a key role on counter-tracing of COVID-19 patients. Apart from educating them on COVID-19, they have also been educated on other health matters including gender-based violence, tuberculosis, among others. They then go door to door, especially to the most vulnerable. They act as a link to the health facilities where they will get sick persons and refer them to the nearest health facility and afterwards monitor their recuperation. They have also been equipped with tools of work by the county government in conjunction with partners.
Kiambu County Government wamekuwa wakitusaidia sana, wametupatia masomo kuhusu TB, kuhusu ugonjwa wa corona na pia pneumonia. Wamekuwa wakitupatia zana za kufanya kazi kama vile gumboots, tumekuwa na reflectors, tumekuwa na masks na sanitizers.
Mambo ya health wanaletaga hii maneno kwa ma-TV, kwa ma-radio, na kuna watu wengine hawana ma-TV, hawana radio, hawana watu wa kuwasomesa. Sasa kazi ile kubwa yetu CHV ni kwenda door to door.
The county government has also fast-tracked completion of other projects. Wangige Level 4 Hospital, which had stalled, is now complete. The close to 200-bed capacity facility will have an operational theatre and solar technology which will be used to heat water and cut on electricity expenses. Repairs on the Larry Level 4 Hospital's operating theatre have been carried out and the theatre is now operational. A generator has been installed at the facility and a 4-story medical wards building is under construction. The county government has installed generators at Tigoni COVID Center, Lusigeti, Larry Level 4 and Wangigi hospitals. The county for the first time has installed laundry machines in the major hospitals. Before their installation, staff would wash linen manually despite the obvious danger of infections. These machines are solar powered, hence cost cutting down on power bills.
Before we were bought the washing machine, the linen were changing colors because of the hard wash. They are not rinsed properly. So when making beds for the patients, you are wondering whether it's a white or it's a cream. But nowadays they are so bright. You think they have been bought that day.
Our hospitals did not have laundry equipment. For a long time, since they were established, they were washing linen manually. But today, I am very, very happy to say that our level 5 hospitals, including Tigoni and on to Wangige, the 4 of them do have operational laundry equipment. In fact, the laundry equipment in Gatondo is a modern facility that is using solar to run and to warm the water.
The county has also partnered with Red Cross Kenya to provide state-of-the-art ambulances. This arrangement has reduced the response rate to less than 25 minutes.
We have quite a number of accidents. You can remember a prominent person who had an accident in Rari, in Kirenga area, and again, the response has not been that good. And therefore, we feel that it is time that Kiambu, being so close to Nairobi and being so close to facilities within us and within Nairobi, that we improve on our emergency response. And the collaboration that we have entered with the Kenya Red Cross is such a collaboration.
When the new administration took over, county medical facilities were deprived of funds. On assuming office, Governor Nyoro assured that the institutions were fully funded and that disbursements are timely. Provision of important pharmaceuticals and non-pharmaceuticals has been enhanced. On matters nutrition, the county government has come up with a plan of starting kitchen gardens in facilities where they have planted different types of vegetables. The vegetables are then gifted to expectant mothers who visit the facilities for antenatal clinics. Expectant or nursing mothers always look forward to their next visit. When attending the clinics, the nursing mothers are also guided on good nutrition and how to take care of their babies. The county has plans to roll out the program in all its 108 facilities. The department, through the leadership of His Excellency the Governor, has promised to continue giving the best health services.